6 approaches to overcome COVID-19 crisis. Traditional remedies only to complement COVID-19 recovery process. Hello and welcome to Updates at Noon. Happy Labor Day, and you're with me, Mohammed Amin Carlos. Now, the government appreciates the contribution of public and private sector workers despite the absence of national-level Workers' Day celebration this year. The Prime Minister, Tan Sri Muhyiddin Yassin, in his special Labor Day address, said sacrifices made during the movement control order is not in vain, as it has contributed in drops of new COVID-19 cases and rise in recovery cases. Well, Tan Sri Muhyiddin Yassin said from the beginning the government has a clear vision in terms of planning its battle against COVID-19 with the implementation of the MCO. Now, meanwhile, to overcome the economic crisis, it said the government has implemented 6 approaches, including the resoluteness in controlling the spread of COVID-19 by implementing the MCO and building resilience through the economic stimulus package to improve the people and economic ability.
Ketiga, menjana semula atau restart ekonomi secara teratur dan terkawal. Keempat, melaksanakan strategi pemulihan atau recovery ekonomi dalam menghadapi norma baru. Kelima, memperkasa atau revitalize ekonomi secara menyeluruh demi kelangsungan masa hadapan. Dan keenam, menyusun semula atau reform struktur ekonomi untuk membolehkan negara dan saudara-saudara melangkah ke arah kehidupan yang sudah berubah dengan adanya norma baru ataupun new normal. Alhamdulillah, pendekatan.
In conjunction with Labor Day today, Chief Secretary to the government, Dato' Sri Muhammad Zuki Ali, said civil servants and the pulse are the pulse and backbone of the country. Now, the COVID-19 pandemic has created a new paradigm in terms of work culture and society's social norms. However, he said civil servants must remain committed and proactive in increasing productivity to drive the country's economic growth.
Perintah Kawalan Pergerakan yang telah dikuatkuasakan sejak 18 Mac 2020 telah memperlahankan produktiviti dari pelbagai sektor perindustrian dan perkhidmatan. Pandemik ini juga telah mengakibatkan kesan negatif secara langsung kepada prestasi pertumbuhan ekonomi negara. Namun begitu, saya yakin dan percaya sebaik sahaja pandemik COVID-19 ini berakhir, pertumbuhan ekonomi negara akan kembali pulih. InsyaAllah, dengan usaha penuh komitmen dan dedikasi daripada semua rakyat, khususnya penjawat awam di negara ini.
He also stressed that priority must continue to be productivity for the sake of the country's stability and economic growth. Besides that, he also outlined 5 basic principles which should serve as guidelines to all the civil servants. They include togetherness, interaction, dynamic, faithfulness, and cultural integrity. There are an estimated 1.6 million civil servants in the country, including frontliners such as the health and security workers who are now working hard to combat the spread of the COVID-19 pandemic. Well, there were 3 new cases involving 2 clusters detected in Sarawak yesterday. Health Director General Dr. Nur Hisham Abdullah said from the church gathering cluster in Kuching, there was 1 new case, making the total number of positive COVID-19 cases in the cluster to 176. There were 2 new cases from the Sarawak General Hospital HUS cluster involving its health personnel, bringing the total positive COVID-19 cases in the cluster to 56, with 35 having fully recovered, while 21 patients are still being treated at the hospital. On the HUS cluster, Dr. Nur Hisham said based on investigations, there were no cases resulting from handling positive cases at COVID-19 wards and the intensive care unit ICU of the hospital.
Sehingga 29 April 2020, seramai 2,003 orang kontak rapat telah dikenal pasti susulan aktiviti pengesanan kontak rapat dengan secara aktif yang dijalankan oleh Kementerian Kesihatan. Didapati 1,950 anggota kesihatan adalah negatif ujian pengesahan COVID-19.
He noted that tight preventive measures were taken, including the decontamination of related areas and active mobilization of personnel from the hospital and nearby health clinics, while patients with weak immune system were transferred to nearby facilities and random screenings was conducted at all high-risk locations in the hospital. The Health Ministry, or MOH, has advised all Malaysian students abroad to take preventive measures, including good hygiene practices, to avoid contracting the COVID-19 infection. Dr. Nur Hisham said this included maintaining a safe social distance, washing hands frequently and using face masks.
Sekarang ni kita tak ada vaksin, kita tak ada ubat untuk merawat COVID-19. Apa yang kita kena laksanakan ialah mengambil langkah-langkah pencegahan.
The Health Director General was asked on MOH's advice to the Malaysian Embassy in Egypt in dealing with students staying in dormitories there after some of them tested positive upon returning to Malaysia recently. Dr. Nur Hisham said the ministry was informed there were many Malaysian students still abroad who wished to return home. Well, the use of herbal remedies and traditional methods recommended by the physicians from China can be only used to complement the recovery process and is not a specific treatment for COVID-19 patients. Dr. Nur Hisham Abdullah said there was still no treatment or cure for COVID-19. Well, the Chinese experts shared what was done in curbing and controlling the infection rate of the illness in their country.
Traditional complementary medicine iaitu mungkin bukan sebagai satu rawatan tetapi sebagai satu complementary, iaitu untuk penyembuhan yang baik dan sebagainya. Jadi memang untuk COVID-19 tiada rawatan lagi, tetapi apa yang mereka cadangkan ialah cara contohnya penggunaan acupuncture dan juga penggunaan herbal mungkin boleh mempercepatkan kesembuhan ataupun dalam perawatan tersebut.
Speaking at his daily press briefing on COVID-19, Dr. Nur Hisham said the Health Ministry team will have an exit conference with the Chinese medical expert and plan on having a more detailed discussion regarding treatment and medicine. The COVID Symptom Monitoring System, or COSMOS, is expected to help medical staff monitor patients suspected of COVID-19 infection. Now, the system, developed by a group of researchers at University Malaya, or UM, will also help those in home quarantine and is expected to also be of use in monitoring medical teams exposed to COVID-19 patients. Well, according to Professor Dr. Chew Thiam Kian of the Faculty of Computer Science and Information Technology, through the COSMOS application, the monitoring process will be automated and patients can insert their daily symptoms into COSMOS, which would be transmitted to the COSMOS primary system at UMMC, where doctors can access real-time information through dashboards.
Buat laporan, sebenarnya pakar perubatan boleh tahu, boleh pantau mereka melalui dashboard. Dan untuk golongan itu, contohnya katakan 10% yang tidak membuat laporan, maka pakar perubatan baru menghubungi 10% pesakit ini.
Through this system, it said medical staff would have to make calls to only 10% of patients in need of supervision, while the rest could be monitored through COSMOS, thus allowing 80 to 90% of medical staff to perform other tasks such as contact tracing and screening. Well, the Federal Territories Ministry has come up with a new standard operating procedure, or SOP, for business operations in the Federal Territories of Kuala Lumpur, Putrajaya and Labuan. Well, its Minister, Tan Sri Anwar Musa, said to ensure the chain of COVID-19 infection is stopped, all businesses in the three territories must follow the SOP even after the Movement Control Order, or MCO, has ended. The Federal Territories Ministry and all agencies under its wing will conduct comprehensive monitoring of business locations, especially on the aspects of cleanliness and health.
Kita punya pegawai-pegawai enforcement, baik di Putrajaya, di Labuan dan juga Kuala Lumpur, yang jumlahnya ribuan, harus faham mereka sekarang ada satu tugas tambahan. Kalau dulu penguasaan soal pelesenan, soal premis, ataupun soal-soal pelanggaran kepada building bylaw dan sebagainya, sekarang kita ada satu tanggungjawab tambahan, iaitu kita harus memantau sejauh mana peniaga kita, penjaja kita dan kedai-kedai di bawah jagaan kita mengamalkan apa yang harus mereka amal mulai daripada sekarang.
The minister added that resident communities are also advised to ensure the virus is contained in their respective areas by coming up with their own SOPs. Tan Sri Anwar said this after witnessing the Light It Blue program last night in Putrajaya in a show of appreciation for the efforts of frontliners in battling the COVID-19 outbreak. Well, the cityscape transformed into a beacon of bright blue to show gratitude and support to healthcare workers, frontliners and other essential workers in the global #LightItBlue initiative. Now, government buildings, commercial buildings and certain roads in Kuala Lumpur, Putrajaya and Labuan will be lit up with blue lights from 10:30 p.m. to 1 a.m. every day until the 3rd of May. Among others, Petronas Twin Towers, Menara DBKL, the Saloma Link, Dataran Merdeka, Masjid Jamik and the Blue Pool of the River of Life project at Sungai Klang were also suitably decked out in electric blue as night fell. Also joining the initiative were Yang di-Pertuan Agong Al-Sultan Abdullah Riayatuddin Al-Mustafa Bilal Shah and Raja Permaisuri Agong Tunku Aziza Aminah Maimunah in lighting the Istana Negara blue.
Saya dan Raja Permaisuri Agong bersama dengan keluarga saya ingin merakamkan ribuan terima kasih kepada semua barisan hadapan dalam kita memerangi wabak COVID-19 ini. Terima kasih.
The initiative was launched by Federal Territories Minister Tan Sri Anwar Musa at the Perbataran and Putrajaya complex in Putrajaya on Thursday. Well, permission to perform Tarawih and Friday prayers in mosques throughout the Movement Control Order is still under discussion. The Minister in the Prime Minister's Department for Religious Affairs, Dr. Zulkifli Muhammad Al-Bakri, said various aspects like security, health and standard operating procedures, or SOPs, implementation will be taken into account before deciding on this matter.
Dan kita juga kena lihat apakah stand kerajaan yang terakhir berkenaan dengan PKP ini, apakah akan disambung atau tidak. Jadinya kami mengambil inisiatif mengadakan perbincangan demi perbincangan dengan Ashabus Samahah, para mufti, ahli jawatan kuasa fatwa kebangsaan dan juga mereka yang terlibat termasuklah KKM. Dan perbincangan itu sehingga saya sendiri pun dimasukkan dalam perbincangan untuk MKN yang dipengusikan oleh Yang Berhormat Datuk Seri Dr. Ismail yang dibuat hampir setiap hari.
He said this after presenting the Aidil Fitri aid to Asnaf in Kuala Lumpur. At the event, a total of 13 million ringgit tithe aid were distributed to 26,400 Asnaf in the Federal Territories. Well, Malacca, meanwhile, allows congressional Tarawih prayers in mosques, but restricted to 4 mosques officials. Well, its Chief Minister, Dato' Sulaiman Mad Ali, however, said the 4 officials, that's mosque chairman, the Imam, Bilal and Siak, must adhere to the standard operating procedures set by the Health Ministry. Well, in a statement released, Dr. Sulaiman said that the approval was given after a discussion between the Mufti's office and the Malacca Islamic Religious Department. And among the conditions that need to be fulfilled are to only perform 8 raka'at of Tarawih prayers, not using loudspeakers, observing social distancing, and officials not having COVID-19 symptoms such as fever, sore throats, coughing, or shortness of breath. Well, Dr. Sulaiman said the state government had also agreed to allow Sharia courts in 3 districts, namely Malacca Tengah, Jasin and Alor Gajah, to sit in on urgent cases beginning 4th May. However, he said the courts were only allowed to operate for 2 days a week throughout the fourth phase of the Movement Control Order MCO until 12 May. Well, Bank Negara Malaysia, or BNM, has required banking institutions to take appropriate steps to ensure that borrowers or customers are provided with clear information on the process and changes to the terms of their agreements. Well, as such, starting today, borrowers or customers with high purchase or HP loans and fixed rate Islamic financing will receive a notification via SMS or email or registered mail from their banking institutions on the necessary steps that they need to take to complete the process of deferring their loan or financing payments under the moratorium. Now, to recap, BNM said allowing the announcement on 25th March 2020, banking institutions are in the process of formalizing agreements which reflect the revised payment terms with borrowers or customers with HP loans and fixed-rate Islamic financing to give effect to the 6-month moratorium on loan or financing payments. In a statement, the central bank said the banking institutions should also roll out convenient means to conclude these agreements in view of the Movement Control Order, the MCO. The banking institutions will also provide to each borrower or customer specific details of changes to the terms of his or her HP loan or fixed-rate Islamic financing agreement. Borrowers or customers who do not wish to take up the moratorium can still choose to do so at this time by informing their banking institutions and resuming their scheduled payments based on the terms of their existing agreements. In such a case, borrowers or customers will be given reasonable time by banking institutions to regularize any outstanding scheduled payments that were earlier deferred under the moratorium. And that concludes today's update at noon. In our top story, 6 approaches to overcome COVID-19 crisis. Well, News on 2 comes on at 7 this evening. Well, folks, please still wash your hands regularly, practice social distancing, and most of all, let's adhere to the movement control. And just stay at home. I'm Carlos. Thanks for watching.